minutes to 8. Why is it that some people are susceptible to long COVID and not others? Well, researchers at universities and hospitals across the country have been conducting tests which may have yielded an answer. Dr Emma Fraser is respiratory consultant who leads the post-COVID assessment clinic at Oxford University Hospitals and is the co-investigator of this study. Good morning to you, Dr Fraser.
Good morning.
Your test involves putting odourless, tasteless gas, Xenon, into lungs and looking at its behaviour of those reporting symptoms of long COVID. Why did you do that and what have you found?
So as a respiratory physician, I've been looking after patients with long COVID since the pandemic really kind of first got going. And what we were finding was that although so many patients, probably about 70 to 80% of the patients that were coming to my clinic were breathless, and yet when we did investigations, when we did chest x-rays or CT scans or lung function tests, we were rarely finding anything that was kind of, explained their symptoms. And so I was really interested to work out if there could be any other kind of abnormality that we just simply weren't picking up on standard investigations, standard tests. So I approached Professor Gleason, who was doing a study looking at Xenon MRI. So essentially Xenon MRI is, it's basically an MRI scanner. So a patient lies in the MRI scanner, they breathe in a gas called Xenon, that's inert, it's a safe gas, but you can visualize it when it goes into the airways and through the lungs. And essentially it tracks like oxygen through the airways, across the lining of the lungs, into the bloodstream and into the red blood cells. And so it gives us an idea of actually what the lungs are doing from a kind of a functional perspective. So it allows us to actually see if there are abnormalities that you wouldn't necessarily be able to pick up on standard tests. So I was just very interested to see whether or not there was anything within the lungs of patients who had long COVID, who were breathless, that could potentially contribute or explain in a proportion of patients their symptoms.
Yeah. And did it depend, was there any correlation? It's quite a limited study and we can talk about what needs to happen next, but was there any correlation between the severity of the dose of COVID that the people had or the symptoms they'd had and their propensity for long COVID? Is it something in the design or the tissue of the lungs? What conclusions can you draw from the people who are likely to be susceptible?
I think at the moment we can't really draw any conclusions. I think what we do know is the people that quite often will go on to having this kind of chronic, relapsing, remitting symptom course with a really quite kind of far-reaching set of symptoms that can be incredibly debilitating, often have relatively mild COVID. And by that I mean they weren't hospitalised. So I think there are so many questions here. And actually, it doesn't seem to be that the severity of the initial infection will predict what kind of symptom course that you have going forward.
Yeah. What do you need to do next? I mean, what are you planning in order to try and crystallise some of these results?
Yeah, so I think, essentially breathlessness is an incredibly complicated symptom. And I think there are many factors that play into kind of our perception of breathlessness. So we know, for example, that people that have long COVID often develop an abnormal breathing pattern, and that can contribute. We know fatigue, we know pain, we know musculoskeletal problems can all impact on that feeling of breathlessness. But what we want to know is, could there also be the abnormalities that we're observing in the lungs that are kind of acting as well to kind of contribute to breathlessness in a proportion of patients? And so,
but just to be clear, are these abnormalities people had before having COVID, which made them susceptible to having long COVID, or is it something in the nature of the way they were affected by the disease?
Yeah, that's a really good question, and one we can't say with certainty because we didn't ever do the Xenon scanning in these patients before they had COVID. But what we can say is when we take healthy controls, their lungs look different, and obviously we can compare the lungs of people that have had long COVID. And by long COVID, what I'm talking about is the patients that didn't come into hospital, rather than non-hospitalised long COVID, compared to those that did come in, who we know had pneumonia. We have evidence on CT scans that they had pneumonia. And actually, it's those two that are fairly similar. So the COVIDs that came into hospital and the long COVIDs that didn't come into hospital. So we don't know if they were abnormal beforehand, but it would be very unlikely, I think.
Dr Fraser, listen, we're going to have to leave it there. So much we still don't know. Such strange footprints that this virus has left in many people. Thank you for that.
It's 13 minutes.